Good afternoon. I'm Dr. Chaturani Mekala Wickramaarachchi. I'm a senior registrar in community medicine attached to the National Program for Tuberculosis Control and Chest Diseases in Sri Lanka. And I shall be presenting to you my oral presentation today. That is the socio-cultural barriers in reaching tuberculosis prevention, diagnosis, and treatment services in Sri Lanka. As we know that tuberculosis is a communicable disease of major global public health interest. And globally, when you take about 10 million of people get diagnosed every year, and it is ranked among the first 10 leading causes of death from a single disease globally. In Sri Lanka, in 2019, Sri Lanka reported around 8,434 new patients with an incidence rate of 64 per 1,000 population. Currently, Sri Lanka is moving towards the end TB strategy to end global TB epidemic by 2025, but somehow that we are not diagnosing enough cases as which is given by the target given by the WHO. So with that, we conducted this research to know we conducted to know the gender, human rights, and the socio-cultural barriers for TB control in Sri Lanka. So which I will be presenting one component of that is the socio-cultural barriers. So we conducted a cross-sectional descriptive hospital and community-based study among 3 target groups, that is the TB patients, healthcare workers, and community members. We conducted 11 focus group discussions and 30 in-depth interviews in 5 districts in Sri Lanka, that is Jaffna, Colombo, Ampara, Palmune, Nuwara in Sri Lanka. So with these, after analyzing these data, the qualitative data, we found out that the religion and ethnicity does not act as barriers for TB management in Sri Lanka. But however, occupation was identified as a major barrier in TB control activities. Some occupations, such as garment factories, plantations, they have higher risk of transmission of the disease TB. And subsequently, some occupations, they lead to lack of proper adherence to TB services as well. And it was the opinion of the study group that since TB is a common disease in the plantation sector of the study, that normally the plantation sector, they do not lose their jobs, but rather they lose their daily wages. So with these, because they lose their daily wages, the plantation sector, they do not like to attend to the clinics or take the treatment, which is because of this great economical problem. So because of this, we found that some of the patients in certain employments, such as the garment factories and in the plantation sector, and also in the transportation sector, they do not disclose their TB status to their employment. That is because they are in the fear of losing their work due to the illness. So when you take the socio-cultural barriers, loss of temporary jobs and daily wages are some economic manifestations of TB. So in conclusion, that we found that occupation acts as a barrier in reaching TB prevention, diagnosis, and treatment services in Sri Lanka. And as the National Program for Tuberculosis Prevention in Sri Lanka, the NPTCCT, we are planning to have targeted interventions for these different communities to set of that consideration of their occupation. Thank you very much. Thank you very much. And I thank the SLMA for giving this wonderful opportunity for our campaign to present our findings. Thank you.